RevDivers. It is such an honor to introduce you to my dear friend, Dawn Lunde. You're going to learn so much from her today. This is going to be a fantastic discussion. Um, Dawn is an amazing powerhouse in the revenue cycle industry, and I'm so excited to have her on today's episode of RevDive. Dawn, thank you so much for joining us. You know, you have so many accolades and you have so much experience in the industry. Can you tell our listeners just a snippet of who you are and what you have done in your career so far?
Yeah, absolutely. Thanks, Kim, for having me. It's always great to talk with you. Well, I actually ended up in healthcare by accident. When I graduated college, it was a recession, and I leveraged my customer service background from my high school and college jobs into a role with a health insurance company. So my first 10 years I spent on the payer side, um, mostly focused in working with the providers in provider relations and contracting. And then I went to work with an independent practice association for a number of years, really doing a lot of the same work, but coming over to the other side of the table and representing those providers in those negotiations. And then from there, I saw an opportunity. As we know in our industry, we see a lot of ebb and flow with physician practices kind of splitting apart and a lot more independence happening out there, and then they'll consolidate, and that kind of happens every 10 or 15 years. And so at that time, a lot of physicians were looking to break away from real large group practices. And so I hung a shingle and did consulting for a number of years, helping them open their own practices, and really just establishing everything with regard to getting their practice going, from space to operations, those important payer contracts. And from there, I was approached by an industry friend who did a lot of work with hospitals, creating their websites. And some of them were asking about online bill pay. And she didn't know anything about healthcare finance, but she came to me and said, well, Dawn, you've kind of done a lot with that. And would you be willing to help me with this project? And so what began as a client project evolved into creating a company and a product known today as Secure Pay. And it focused on patient pay. And little did we know, we were doing that in a recession, the earlier days of 2008. You'll probably remember the housing market crashing and all the banking issues. And it was really coinciding with a time where patient pay was really escalating because benefits were changing. Patients were having to pay more out of pocket. And certainly in the years since 2008, we've seen that really explode. And so we ended up taking that client opportunity into a company that became a part of Ability Network about 4 years ago.
Awesome.
So I've been there ever since.
Wow, Dawn, that is so impressive. When I think about a career like yours, there has to be something driving you to continue doing what you do. What draws you to be so passionate and engaged with revenue cycle transformation? I know I am, and every time you and I talk, I feel that that drive in you. What kind of draws you into being passionate?
Yeah, well, fundamentally, I think, my nature lends itself to problem solving and helping and making things better. I think I was drawn to the industry having grown up around it with the professions of my parents, but also just sort of that desire to be able to help. Now, that being said, I am not a science type gal. I did not want to pursue the clinical side where, it certainly, would give me the opportunity to do that. And I had more of a mind for math and for systems and bringing efficiency to a process. And I think I naturally fell into it in the point of my career where I began to work with providers. It's their lifeblood. and really just seeing the handwriting on the wall with how our industry was transforming. And so what drives me is how what we do sort of perpetuates the ability for healthcare providers to provide patient care. And, as they say out there, no money, no mission. And so
Right.
if we're not focusing on ways to make the collections as much as they can be, we're really depleting, organizations' ability to keep doing what they're doing.
I totally agree. Oh my gosh, such a good point. Um, you know, and you are, an avid and well-regarded speaker in the area of patient financial responsibility. And collecting patient financial responsibilities is challenging for many organizations. Again, especially right now, as we're kind of working in a virtual environment and hybrid in office environment. So let RevDivers podcast be a megaphone for a moment. If you could pop one message into the minds of all revenue cycle leaders and our RevDivers who listen in to this podcast, be their muse, so to speak, what would you say to them?
Well, great question, Kim. One thing I read recently that even surprised me, having been in this industry for so long, is that 61% of patients would consider switching providers just to have a better experience with patient payments. I mean, that's almost 2/3 of patients. And one thing I think our listeners might not always think about is that payment experience is almost always the last experience or exposure that the patient has to the organization. And if it isn't pleasant, sadly, they're left with a bad taste in their mouth, and they might share that with others. And even though their care could have been excellent, if that final step was not, what is it and how is it reflecting on the organization? So it can impact, quality outcome scores when it really has nothing to do with the quality itself. They could vote with their feet and just go to another provider, or just simply be bad mouthing, the organization for something that to some people might seem trivial, but it is important to consumers. So I have a lot of suggestions I could offer. First and foremost, focus on getting into the digital age that we're in, and have been in for a while. If you don't already have online bill pay that allows a patient to pay any way that they could, go ahead and get that going, because not only will it make it a lot more accessible to the patient, but the time that it'll save the staff. You figure for every 5 to 10 minutes they spend handling a payment, what else could they be doing? There's no shortage of work in a practice, right?
Yeah.
Um, the other thing I would say along the lines of leveraging that technology, that's actually really interestingly become a lot more to the forefront now than ever with the pandemic.
Oh,
And
yeah.
that is the desire that consumers have for touchless payment, at the point of service,
Mhm.
or even if they're doing drive-through type care, how can they pay in a way that they don't need to touch something or hand their card over to someone else. And I know we saw just a surge, a huge increase in the use of touchless payments, when that pandemic hit, alongside, a very large increase in the use of online tools overall. So if you don't already have those capabilities, those are the best recommendations I can make. There's many
That's
others I could
fantastic.
share, but those are the top
That's
two in front of
no,
mind.
I think that's fantastic. My thought is removing any barriers is the key. So whatever your barriers are, how do you remove those barriers? And I think that that's a great suggestion. One thing that you said, you talked about the patient experience and
Mhm.
how usually if you think about it, as a patient is, let's say from an ambulatory perspective, when a patient's checking out, someone's looking for money from them, right? So that's usually their, like you said, their last experience.
Mhm.
And I think an educated patient is a good patient, right? So giving patients as much information as possible. That also contributes to customer satisfaction. Um, and when it comes to speaking with patients in an engaging and an informative way, um, we can really help with their health literacy, whether it's financial health literacy or explaining their disease etiology. We can really, as healthcare leaders, do so much. And you know, I believe that health literacy plays an important role in patient collections because the more they understand about what's happening, the more they're inclined, I think, um, to understand the provider's role um, in in their overall care, and they might be kind of more inclined to make their payments. Um, do you have any thoughts? I mean, I'm sure you're shaking your head. What are your thoughts about engaging, patient engagement and health literacy um, campaigns to educate our patients? Again, whether it's for financial management, and we both know not all patients really understand what is an EOB. That's who knows what that is. So,
Right.
what are your thoughts about patient engagement and literacy?
Yeah, I think sometimes the simplest actions can have the biggest impact. If we think of, the patients that are being seen are either in an emergency situation, at worst, and at best they're there for a physical or some preventive, type care, or anywhere in between. I would believe most people in that situation already are feeling vulnerable, um, worried, concerned. And I think when people get into that state, they're not kind of thinking as clearly as they could. And so, one of the strategies I've seen be very successful, and again, this is very simple, but it's just expectation setting. So whether it's, the clinical staff that is explaining each step of the way, I think all of us could think of a healthcare experience or dental, that we've had where they just start doing something and we don't know what they're doing, and it makes us very anxious. And so to just explain what's about to happen immediately before it happens, or preparing them for what is to come, whether it's minutes, days, weeks, months ahead, immediately will bring kind of a more calming situation for that person. And when we bring that anxiety level down, I think they're a lot more likely to hear us
Yeah.
and do what we'd like. So from the RCM standpoint, the financial side of this, it's little things, it's appointment reminders that are convenient. Do you offer options for them to get those by text and or email, or is it outbound calls?
Right.
Can they schedule online? Can they be informed when they're checking in of what the organization knows about them? Hey, Dawn, welcome to your appointment. We verified your eligibility with Cigna,
Right.
and we found that you will have patient responsibility of X, or approximately X. I know we don't always have that definite number, and we'd like to discuss with you arrangements for payment for that, or how would you like to pay for that today?
Yeah. Yeah.
And that way it doesn't come as a bill in the mail 40, 60 days later as a shocker. And the patients are a lot less likely to want to, pay timely when they didn't expect it.
Totally agree.
So just a few ideas,
Yeah.
things, strategies I've seen out there that have been effective.
Awesome. I want to switch gears a little bit and think about our listeners, and because they're individuals looking to grow either personally or professionally, and we both know that it takes a lot
Yeah.
to sustain a career in revenue cycle management. revenue integrity. You know, from your perspective, what's the most important strength that revenue cycle leaders need to be successful?
Oh gosh, there's so many.
I know.
One I would offer, it's a little more general, and it's for people in all levels of revenue cycle leadership, or part of the frontline staff. I think it's helpful to be networked in your field outside of your organization. And so whether it's engaging through platforms like this, industry associations, the organization next door to you, whatever it might be, I think the idea sharing, knowledge sharing, or even just the camaraderie, because let's face it, it's not always easy out there, um, can really be helpful. And I can say, having worked in healthcare my whole career, which has been long, really some of my best friends are those industry connections that I have. And so not only can I go to them with an industry question or need, but I've developed more of a relationship with them as well. So that's a recommendation. I think sometimes people, when they're in a larger firm, get very inwardly focused, and they may not have those connections outside of their organization. And conversely, some with a really small organization, I see it's pretty common that they're not connected, and it can feel lonely, I think. Sometimes people might wonder, am I the only one going through this? The answer is
Yeah,
no. You and I have
exactly.
the viewpoint of working with so many organizations at the same time. I think we see a lot of themes out there.
Oh my gosh, you're so right. And you know, I used to love going to conferences and in-person seminars. And as a
Yeah.
speaker, I always enjoyed the point in my program that I opened up networking opportunities. And I think that you are spot on. Um, Networking outside of your organization and even with your external stakeholders, right? So you mentioned that you were on the payer side at one point. I'm
Right.
sure, like I know when I used to be a bill auditor at a hospital, um, I became, I got acquainted with the representatives of the insurance companies that I was dealing with, right? And so building those networks really help you as a revenue cycle leader, because you don't, you certainly can't do your job alone. So having people who you can rely on, and then also folks can rely on you for your expertise, right? I think it's kind of like, isn't it a great two-way street? Like you and we've emailed each other before and shared information. Um, so it's really great. And I know that also with networking, building your capacity for growth, um, sharing information. When we share information with one another, we're continuing to grow. But what that also does is the person who you've shared that information with is also inclined later on to share information with you. So,
Yeah, and
yeah.
even pay it forward to someone else, or bring someone up in their career. Or I too have felt, some of these individuals I've known for 20, 25 years, they've pushed me along professionally, whether it's encouragement or support, or throwing ideas my way, or vice versa. Like you said, it is a great two-way street. So,
Yeah.
and it's how
Um,
we met, right, Kim?
exactly. Through networking.
Exactly.
We're obviously so impressed with your expertise and your knowledge. And we also know, at least in my opinion, that the biggest points of formation, at least in my career and in my growth as a person and as a business owner, often come from failure. I mean, there's things that we're going to do, we're going to mess up, and we're not going to always get it right. um I'm sure I can share, quite a few stories of decisions I wish I would have reconsidered.
Uh-huh.
When you think about a time where you maybe experienced a failure, and it was a catalyst for growth, whether it was personal or professional, what comes to your mind? I mean, I could certainly share a lot, but from your perspective, what does that catalyst do for you?
Yeah, well, in the early days of Secure Pay, I was a part of another startup. And there's some statistic out there about how few of them actually turn into a success. So I consider myself to be very fortunate there. But there was another one I was involved with that involved the capability for consumers to come onto a website and compare healthcare providers, quality, and cost, and the cost being derived from, as we know, those payer contracts. And boy, we made a run at it, I think, for almost 5 years, and just it was the worst feeling to finally decide to call it quits. Um, I think we were too early to market is why it didn't go. I think we see these days with so much consumerism in healthcare that a tool like that would be very helpful. It is hard to provide an estimate and share that information. And whether we like it or not, consumers do shop around for everything, even their healthcare. What I learned from that is sometimes we can have a great idea, but the time might not be right for that idea. And
Mhm.
and to not just give up on it entirely, but is there another form that it can take, when in the right time. So
Yeah,
there's many others, like you said, we've all had
yeah,
many failures, big and
yeah.
small. But
I was in another interview and I was asked a similar question, which is why it came to mind because
mhm,
I think it's so powerful to not only look at our successes, but look at things that we wish we could have done differently. And I know
mhm,
that, in the early the formative years of leadership for me, um, I I looked for my team to be as passionate as I was, and for my team to think and kind of process information similarly to how I process it.
mhm,
And I think growing as a leader, I realized that I need to embrace individuality and diversity and, differing opinions and differing thoughts because all of those thoughts they bring different perspectives and it allows you to kind of open your mind to new possibilities as a leader and it allows you to grow. So we could go on and on.
oh, I couldn't agree with you more. Yes, I mean, the people, the don't you have people in your life, the yin to your yang? I mean, your strengths and what is your kryptonite, and they are there to provide that balance to you. I definitely know the people I go to kind of balance out my approach. And I love your comment about diversity of thought. Really makes for a more complete approach on anything. Um,
Totally agree.
that's
Totally
great.
agree. As we're wrapping up, first of all, thank you so much for being with us today. I know that our rev divers are going to gain a lot of knowledge from this podcast. However, I this is our first official sponsorship of our rev dive podcast, so I want to thank Ability so much for sponsoring today's program. Um, a lot goes into the development and output of information, regardless of the format. This is a podcast format. But I'd love to just take a couple of seconds to thank you guys for sponsoring us. We know that there's so much that Ability offers to the industry. If you could encapsulate what Ability kind of supports organizations in, I'd love to hear about it.
Yeah, sure. Yeah, so Ability Network interestingly, is a company that handles about 96% of all Medicare claims in the United States. We were the first organization to help providers connect directly to Medicare, and that's our roots. But what a lot of people don't necessarily realize in the industry is how much we've grown in the last 20 years to include really full capability for revenue cycle, clinical quality applications, as well as workforce optimization. So we have everything from how you'd manage your claims and eligibility and patient pay, telehealth, capabilities for skilled nursing facilities to be tracking more efficiently their MDSs, and for all healthcare to more optimize their scheduling and have insights, which has been a bigger deal lately with a lot of staff burnout brought about by the pandemic. So it's been a pleasure to be with you today, and we really appreciate the opportunity to sponsor what you're doing. We think it's great and very needed in our industry. A great way to reach so many people.
Yes, awesome. Well, again, thank you so much for being with us today. RevDivers, I hope that you've enjoyed today's podcast. We have so many more great episodes coming your way. We try to continue to get great content out to you, fantastic speakers like Dawn Lunde. Until next time, take care and stay safe, RevDivers.